Sleep was impossible for me when I was in chronic pain. When people ask me these questions, what's the best seated posture? What's the best sleeping position? What's the best mattress? What are the best shoes to have? The insoles? What are all these things to work around living with back pain? To be honest, I don't know the right answer because it just fucking sucked. Like nothing worked for me. There was no way to sleep. There was no way to sit well. There was prayer and time and actual work. And so we can't ever get away from the fact that we just have to improve the underlying root problem. But try stuff in the meantime. For survival in the short term, sleep with a pillow between your knees. Try the left side. Does that feel good? Try sleeping on the right side. Maybe a small pillow underneath your back and underneath both your knees, lying on your back. Those are the go-to things people try. Usually everyone agrees that having a firm mattress does better than a really plush, soft mattress that you sink into. I had a client, Kartik from India, is a legendary member in LBA, and he slept on the floor the whole journey of his low back rebuild while he was training the program. And he did it because of his back pain. And then as he built himself up over the year and got to doing strong reps on the back extension, and he just physically couldn't hurt himself anymore with his back, he now just always sleeps on the floor. And to me, that was always really inspiring and eye-opening. And it's probably a hard thing to get adjusted to in the beginning, but seems intuitive, as if that's more natural to how we should live, but I haven't done it. What about one-sided pain, painful to touch, going to the glute? That's a little unspecific. I know you laid out the area well, but does it feel nerve-related? Does it feel like referral pain, that it shoots out? That's the tricky thing with back pain. It can be hard to distinguish. Is that a joint issue? Is that the SI joint? Does it feel like a ligament? Does it feel in the in-between areas, or is it right on the muscle? Does it feel burning, or is it more of just a dull ache? Even with that pain, your question, what about it? We got to think sometimes beyond level 1 of experiencing pain, right? So the best advice I could give for someone struggling with chronic back pain is to become familiar with your pain and not avoidant, and go beyond just how much it sucks and actually find patterns to it and feel it fully that, okay, it always happens after these days of lifting. And then you can start to mark out what you may be overdoing and what sensitivity is being flared up. Or you can look at what periods of your life it started to act up and when it didn't, or how long does it last, or what things give you relief and what things don't. Not to say you're going to solve it right away, but like I said earlier, you're just trying to map out what seems mysterious and for no reason actually usually isn't so much so. The symptoms are saviors. They're yelling at you to be paid attention to. The pain has some kind of purpose, even if you can't map it out yet.